All right, recording has started. I'm here with Anton Harb Jr. He is a veteran. He's been very active in the cannabis space, crossing the bridge to veteran issues along with cannabis, and to a greater extent than that, uh, in an ongoing effort to try to let people know the types of things that Med Cafe supports, connected to, relationships with, things that everybody in the company contributes to. I brought Anton on for this video, and I just thought I'd let him introduce himself a little bit and his journey into this cannabis world, and then we can discuss like some of the projects I know that have taken place and have seen some success, and then a couple things you're thinking in mind, for the future, and how we
Sure.
might be able to help out.
Of course. Well, thanks for having me, Jamie, as usual. Yeah, I'm Anton Harb Jr. I'm an Iraqi war veteran. I was an Army officer, I was a field artillery officer, served in a reconnaissance unit in Iraq in 2005, was discharged in 2007. Having seen things I saw overseas, as most people who have served who come back, we suffered different ailments. For me, it was PTSD. I'm also a cancer survivor from the burn pits in Iraq, and I'm also a suicide survivor. So, for me personally, as a veteran in the cannabis community and in Michigan in general, I kind of recognized there was a lack of resources for veterans to access, not only in the veteran community, but in the cannabis community. And my goal was to kind of bring that veteran voice to the table. And, my healing journey after, being subjected to years worth of poison from the VA, everything from fentanyl and oxy to every mental health medication you can think of, to the point to where my body just started to shut down. And again, with my history of cancer, it was an obvious choice to lean towards cannabis as a medicine. And having tried it and having great success, I wanted to bring it to my community and show that there are alternative methods to healing. And in Michigan, we're extremely fortunate to have both medical and recreational laws in place. And I do the best I can to get that voice out there. I host Fob 1620, hosted by Redemption. I co-host with you on Jazz Cabbage Cafe. So when I think of Meds Cafe, I think of Jamie Lowell. I know Josh Covert's out there doing tremendous work for the community, and Jamie, I look at Jamie as a real friend who I've leaned on several times. So as long as his name is connected to things, I'm certain things are being done properly. So that's kind of a little about me. Oop, you're muted, brother.
Perfect. Okay, so I appreciate it, and and so in order to get the VA, which is federal agency, kind of on board with more broadly accepting cannabis. A lot of issues, have been there. The federal status of cannabis is remaining illegal on the controlled substances list, and the VA not going along with it. And the only way that it might move is if there's movement with the controlled substances list. There are subsequent studies that might demonstrate that they really should be looking into this. And in the MRTMA, the legalization language in Michigan, was slotted for up to 2 years of $20 million of the tax revenue to go toward research. Anton became aware. I think some people let him know there are some issues with how this money is being spent, and he really took some action. And we'll talk about that in a second. But the reason that it was really important that the money be spent as the law described, and that is by way of having really high standards with the FDA, was so that such a study would be considered strong enough for the VA to take seriously and to possibly change policy with. So to not use the funds in that direction, and these don't become available for this type of thing very often or this much, and to not use the funds to really head in that direction was something that Anton saw as a big issue. and then took action. You got a hold of the department and many others, and got the word out, and eventually worked it out. But if you want to describe that a little bit, the work that you did.
Sure. Yeah. So, and it's important to point out. So, within the MRTMA, we actually allotted like you said, $20 million over 2 years for a total of $40 billion, which was derived directly from excise taxes from recreational sales. So this was not only a funded by voter ballot initiative, but by the people themselves through their purchases of cannabis. And this $40 million over the 2 years was written into the law to include that the grantees would spend the money on FDA approved clinical trials, and the importance to study marijuana within the veteran population, veterans with PTSD, to help lower the suicidality rate among the veteran population. And that was what was put in there for. I was able to identify, it just piqued my interest. I began to look into it, and we had three organizations who had received money: the MAPS Foundation, Wayne State University, and the University of Michigan. And they were given a various amount of funds. MAPS was given 13 million. U of M got 8, and then Wayne State got about 19 million bucks. So at the end of the day, these folks were tasked to do these FDA approved clinical trials. But what we don't realize is when we're dealing with Schedule 1 drugs, it's very, very difficult to do. It's done. It's happened. And but I was able to recognize that the way the studies were being conducted as authorized was not legal. It was within the law. And how does little old me raise my voice and say, hello, it's important that not only government, but these people who receive this grant money are being good stewards of the taxpayers' money, not only for the taxpayers, but for my brothers and sisters. We have 22 veterans a day who are ending their lives to suicide that don't have access to proper medicine. And it took months, and it took pressure, and it took tenacity, and it took phone calls, and it took a lot. But at the end of the day, I was able to work. CRA was wonderful in the way they facilitated things, and we were able to work with the grantees and allow them to come into compliance with the law in the way that they were proposing their studies. But really, at the end of the day, Jamie, I'm sure as you know, that's only one piece of the puzzle now. Now that we have institutions recognizing that, observational research was not allowed and it wasn't what the law was mandating, there's a lot more hoops that they have to jump through, right? And now to get FDA approval, I've worked with the MAPS Foundation. Currently, I'm working. I'll be actually flying to Washington D.C. over the next month or so, and I'll actually be arguing for part of it's called the self titration protocol, allowing veterans to use medicine when they need it. Instead of having the FDA approved 5 puffs 3 times a day. That's not realistic. That's not how we use it, right?
It's plant medicine.
It's plant medicine.
Doesn't need to be an FDA
doesn't work that
approved
way.
pill or something like that. But
Correct.
The standards of testing are important because they are convincing. And
yes.
Yep. And
the reality is, so I will, my work is really, I don't say just getting started, but trying to convince the FDA to allow this so that MAPS can actually move forward with stuff. MAPS has been doing this for almost 2 years, trying to get authorization.
And Wayne State University and University of Michigan are the other 2 research.
Yeah, and they are not even in the ballpark of being close to anything that even would resemble an FDA approval yet. Currently, they're working on it, I'm being told, but really now the work is, where is the money going? If 40 million bucks has never ever happened in the history of our country for cannabis research, and it's an unprecedented amount of money. And when you have that type of money, I always say there's no such thing as trust, only accountability. And I'll be honest, we do have concerns about some of the spending that's going on. And we have, I'm working with some of my other veteran counterparts. We've hired CPAs, we have grant experts. We're going through everything with a fine tooth comb, and we will hold everybody accountable. We just ask that you do what the law said, and you be good stewards of the money, and you spend it properly. That's all.
So you got it pointed in the right direction. Now you have to kind of oversee it and make sure that that whole process continues. So
Yes,
that's really cool, though. I thought people should know about that. That was some significant work, and you maintain a good relationship with the department
I do.
in part from that, and a lot of good stuff came out of it, and you continue to do stuff. So before we end, and all of these videos right now should be considered somewhat introductory. We'll talk with everybody on here more as we do more things and that type of stuff, but give a quick overview of things we can look forward in the future, and the project we discussed, we might help you out with.
Yeah. So yeah, Meds Cafe. Boy, I'm a big fan. So one of my goals within the cannabis community is to bring access to veterans who may not otherwise have it, be it either financially not able to obtain products, or even just we have folks who are amputees who can't leave their home to purchase products. So how do we create that access? I for about 2 years now have been I've worked with other organizations that didn't work out, but now I have been speaking with Redemption Cannabis, who is a big force of nature in the industry, and have been yeah, exactly right, yeah. So my goal with this project now is to bring those good actors, those folks who we really know are doing the good work and who are passionate about it. Meds Cafe, I believe we've Stone Depot. There's these other brands out there who have created brands not just because of the cannabis products that they sell, but because of the good that they do in the community. And to me, that is more important than the product itself. So we're working on a program. We want to give free weed to vets, and that's the goal, and that's what we're going to do. And as this rolls out, we'll have more details. And I mean, Meds Cafe being a part of this would mean the world to me, because I believe in you, Jamie, and I believe in what y'all are doing. So, and I hope y'all believe in what I'm doing, and we find that synergy there.
Man, we have vets in this company, and many who understand the importance of supporting the veteran community for a long range of reasons. So uh, yeah, I think this is going to be well received, and we're happy to offer support as much as we can whenever we can. I'm sure Josh is right there.
I appreciate the hell out of you guys.
Yeah, so of course, as you mentioned, you co-host with us on Jazz Cabbage Cafe, and oftentimes we discuss what's going on with you and update on stuff and your projects. And then you have the 1620.
Oh, Fob 1620, yeah.
Fob 1620, and you get into more of the really specific veteran perspective on a lot of issues, and it's with other veterans in the industry.
Yep, 100%. We want to make that platform and give veterans that voice, and we want people to be engaged. We want people who are not veterans to engage with us so they can learn from us, and we want to help the community, because that's what we're about. We're about service. We're about serving our country, our community, and everybody involved.
Right on. Very cool, man. Well, we'll be back getting updates and discussing how we're going to do some good work together, I'm sure. So thanks a lot, and we'll talk soon.
Appreciate you, brother.
See you, man. Bye.